Hello, Assalamu alaikum everyone. And this is my 14th lecture on the topic of thanatology. And in this lecture, I will be discussing stage 2 of putrefaction. As in the previous lecture, we started the discussion of putrefaction and we discussed in that the stage 1. In stage 2, the effects are produced because of the production of gases and their pressure effects. There is ballotment of features, shifting of hypostasis because of the pressure of the gases, and there is distension of whole body. And with the pressure into the abdomen and the chest cavities, there will be emission of fluid from the orifices. And the feces can be pushed out of the rectum, and similarly the fetus out of the uterus if the female is having it. Then we'll continue the putrefaction into stage 3. In this, there is softening and liquefaction of the whole body, bursting of the cavities occurs, complete skeletonization, and decomposition of bones. Then we will discuss in this lecture the putrefaction of internal organs. And the rule for this is that the organs which are soft and have abundant blood supply, they are to putrefy first. Whereas the hard organs, more fibrous, less vascular, they putrefy late. So the prostate and ovaries, they are considered as to be last to putrefy. So these structure, as they are contained in the more protected compartment like pelvis and resist putrefaction, these structures help an important parameter in identification of sex in more advanced putrefactive stage of the body. And similarly, the gravid uterus, as it is more vascular and soft, it is first to putrefy. So, continuing with the lecture number 14, we will discuss all these stages. Okay. So, starting with the lecture number 14, Bismillahirrahmanirrahim. The learning objectives of this lecture will be that we will discuss the stage 2 of putrefaction, that is the production of gases and the pressure effects of these gases. And this will cause the ballotment of the features, shifting of hypostasis, distension of whole body, and emission of fluid from the orifices. And the intra-abdominal pressure because of the gases may rise so that it will push the feces out of rectum and fetus out of uterus. Then we will discuss the stage 3, which is the softening and liquefaction. There will be bursting of cavities, complete skeletonization, and decomposition of bones we will discuss. Then we will discuss in this lecture the putrefaction of internal organs. And for internal organs, the basic principle is that the soft organs having the rich blood supply, they putrefy early. And the hard organs, more fibrous with less blood supply, will putrefy late. The putrefaction of the internal organs and external features which are visible, all the changes start at the same time. Then The prostate and ovaries, they are last to putrefy because they are more fibrous structures and they help in identity, especially in extensively mutilated remains, as these organs are at a safe place within the pelvis, and as the putrefaction is lost in these organs, they help us in the determination of the sex of the individual. The gravid uterus, as it is rich in vascularity, it is first to putrefy. Now the stage 2 of putrefaction. There is production of gases, and within 24 to 36 hours after death, they develop and the foul smell starts emitting out. They accumulate in the hollow viscera first, then the solid viscera. They can also undergo putrefaction and the gases accumulate even then. And then it becomes accumulated under the skin. In next 24 to 48 hours, the gases which have been now collected in the hollow viscera, they are so abundant that now they produce false rigidity of the whole body. And these exert considerable pressure which can emit the contents out of the cavities, like the fluid from the mouth and nose and the feces from rectum. So the main gases which are responsible, they are the hydrogen sulfide, ammonia, phosphorated hydrogen, carbon dioxide, and methane. Then what happens when the gases put pressure on the body because of the collection in large amount? The quantity is increased gradually, and due to this, the pressure effects on various tissues appear. And these pressure effects are like the ballotment of the features, that the facial features are balloted or swollen, face is swollen, and identification now will become difficult. The tongue, lips, nose, eyelids, and cheeks, they are also distended because of the accumulation of the gases. And face, due to liberation of the self-met hemoglobin, becomes bluish green. The tongue is pushed out, and in females, the breasts, they are swollen and bulging of the lips, and the condition of the body can be confused with some homicidal blunt trauma. This is how the features are swollen, the tongue is protruding, and recognition or the identity becomes difficult. Then these gases put so much pressure that the hypostasis, which is now on the dependent, initially it was on the dependent areas, now will shift to any site because of the pressure. Because of the putrefaction, the blood which was clotted will be hemolyzed. And the pressure effect of these gases on this hemolyzed blood will cause shifting of the postmortem staining in any direction. Then the distension or ballotment of whole body, which is in 2 to 3 days. And this condition is due to formation of gases which cause generalized swelling of the body. And the ballotment of the face and neck When it occurs, the identification of the person and facial features becomes difficult. Eyes are tightly closed or they may be proctosed, protruding out, and swelling of eyelids will be there. Cheeks become puffy, lips become thick because of the accumulation of gases. The tongue is swollen and is protruded between the teeth. This is the swelling of the face. This is a model showing the ballotment. Then, because of the accumulation of gases, there will be distension of abdomen. And the gases collected in the intestine and the stomach will push the blood-stained fluid and froth, which is a putrefactive fluid, out of the mouth and nose. The nostrils and the mouth will be emitting this putrefactive fluid. And stomach contents also come out through the mouth. And the feces from the rectum, they are also pushed out by the pressure effect of these gases in the abdomen. The breast, scrotum, they are ballooned out and fetus may be expelled because of the pressure effect of gases in a gravid uterus. The hair and nail can easily be pulled out and be detached. This is the ballotment of the whole body. The scrotum is massively swollen. Then the fluid and froth which emits from the mouth, it is because of the pressure of the abdominal gases which push the diaphragm up. The lungs, heart and stomach are pushed upwards, which results in emitting out of fluid and froth from the mouth and nose, like this. And this may not be mistaken as any homicidal event because other putrefactive elements like foul smell and other skin slip, they may also be visible. The condition of the genitalia: in male, the penis and scrotum become swollen, and in female, the genitals appear pendulous. And in pregnant ladies, fetus may be expelled out. Now, the third stage of putrefaction, which results in all the tissues of the body undergo softening and liquefaction. The cavities will burst open in 3 to 4 weeks, but the rate at which the organs undergo this depends upon the amount of muscle and fibrous tissue in them. Then the whole body is skeletonized in 1 to 3 months. The decomposition of bone in uncoffined, it takes approximately 1 year, and in coffined in 3 years, and complete destruction of bones in 25 years. Then the putrefaction of internal organs. This is important, that putrefaction internal organs starts with the external signs of the putrefaction on the body. And the principle is that the organs which are soft and which are rich in blood supply, they putrefy early. And the organs which are hard and having less blood supply, they putrefy late. So internally, the putrefaction progresses such that it starts from the undersurface of the liver, being close to the contact with fluid and the bacterial contents of the intestine. Blood is hemolyzed and hemoglobin is liberated, which is then converted into self-met hemoglobin. combination with hydrogen sulfide. And this is because of the Clostridium welchi, which produces hydrogen sulfide, and this sulfate hemoglobin then separates to the whole body in next 48 hours. And this greenish discoloration separates to the whole body, both internally as well as externally. The sequence or the order in which the internal organs undergo putrefaction: stomach and intestines and liver, blood and heart blood, they are first to putrefy. Then trachea, bronchi, lungs, larynx and liver will follow. Then brain and spinal cord, heart, kidney, bladder and diaphragm, then skeletal muscles, and last the prostate, testis, uterus and ovaries. But gravid uterus is first to putrefy. So summary of this lecture is that we have discussed the stage 2 putrefaction, which is mainly concerned with production of gases and the pressure effect of these gases. And there is ballotment of facial features, shifting of hypostasis, distension of whole body, emission of fluid from the orifices, and it also causes pushing of the feces and the fetus from the uterus. Then we have discussed the stage 3, in which the softening and liquefaction occurs. There is bursting of the cavities, complete skeletonization occurs in 1 to 3 months, and the decomposition of bones. We have various stages we have discussed. Then we have discussed the internal putrefaction of the internal organs, and the rule is that the soft organs which are rich in blood supply, they putrefy early, and the hard organs we have less blood supply will putrefy late. The prostate and ovaries, they are last to putrefy, but the gravid uterus is first to putrefy. Thank you very much. So this is all about lecture number 14. Take care. Allah Hafiz.